You know, one trait that many people have told me that I possess is the ability to take a complex subject and make it easy for the layperson to understand. I mean, that's why I decided to start this very YouTube channel in the first place. So imagine my excitement when I came across an article entitled Top 10 Motivational Oral Hygiene Analogies in one of our dental online journals. I think these are brilliant, and I hope you find them motivating as well. Let's go. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the US. So in today's short video, I simply want to relay to you the analogies that these particular dentists and hygienists have used to help their patients understand the importance of exercising proper oral care. Now, I'm guessing that you have been bombarded with the need to brush at least twice a day, floss between your teeth, maintain a well-balanced diet, limit the amount of sticky, sugary snacks you consume, and see your dentist twice a year, or at the frequency they recommend. But tell me the truth, doesn't this stuff kind of get tuned out when you keep hearing it over and over and over? Well, perhaps explaining the need to do these things in a new and refreshing way just might be the ticket to better compliance and better results. So without further ado, let's get right to it. This first one is near and dear to my heart, as I have ranted about this in several videos of mine, and it comes from a Dr. Greg Kurtzman, and he says, if you brushed your hair and had blood on the hairbrush, would you think that was normal? So why is blood on your toothbrush normal? Bleeding anywhere is a sign of a problem. Way to go, Greg. As I like to say, blood is supposed to stay on the inside. Next up, we have Dr. Addison Killeen, who states, gum disease is like an infection the size of your fist. Imagine if that were on your arm or leg and it bled every time you touched it. Would you go to the doctor to get it fixed? Excellent, Addison. Dr. Audra Ward says to her patients, why do you need to brush and floss? Have you ever taken your dirty, filthy car to a car wash that only sprays water? It still comes out gray and not totally clean. If you take it to one that has water and the mechanical action of brushes, the car comes out much cleaner. It's the same with your teeth. Beautiful. Hygienist Carrie Rossiello uses a pool table to help her patients understand the space between the gums and the tooth, called a pocket. She says, when describing pockets during probing, I tell the patient that it's like a pool table. The deeper the pocket, the more pool balls can fit. Just like the deeper the space of the pocket in the gums, the more bacteria can get in there and cause a problem. I like that. This next one is one of my favorites, and it comes from a Dr. Martin Courtney, who says, I take the plaque on a Perio probe, that's an instrument used to check your gums, and ask, if I put this on a cracker, would you eat this? He always hears, gross, no way, yuck. And then he says, well, if you're not brushing and flossing, anytime you eat anything, you're eating this. He'll pause and then state, it makes sense to brush and floss, right? As a patient, I'd remember that one for sure. Dr. Maxine Feinberg uses this analogy to help her patients understand the need for a more deep teeth cleaning when compared to a typical routine cleaning. She will tell her patients, we clean our office every night, which is like your regular cleanings, but twice a year, we have the cleaning people in to do a more thorough cleaning. Like spring cleaning, they clean into the corners and the ductwork, etc. Root planing, or a deep cleaning, is like spring cleaning. We get deeper under the gum tissue and thoroughly clean the root surfaces. This can't be done at your regular visits. Nice. Here's another great one from hygienist Sandy Swanson Nyquist on brushing and flossing. She says, you cooked a great spaghetti dinner and sauce gets on the top of the stove and the wall behind the stove. After you're done, you clean the stove and countertops until they are spick and span. Now pull the stove away from the wall and it will be dirty. Brushing is like cleaning the top of the stove and the countertops. Flossing is like pulling the stove away from the wall and cleaning behind it. I love it. This one from hygienist Nina Carisi is a great way to convey the fact that your gums get stronger the longer you floss. And here's her analogy. When patients complain about how their gums bleed when they floss, she says, if you walked a mile barefoot today, would your feet bleed? They usually say yes. Then I ask, if you walked that same mile barefoot every day for a month, would they still bleed? Then they all say, no, probably not. I tell them it's the same with their mouth and flossing. From hygienist Holly Gamal Kasia, and apologies if I didn't pronounce that correctly, Holly, on the benefits of the hygiene visit, I think of deep pockets like the deep end of a swimming pool. You can take a skimmer and clean the top surface of the pool. That would be brushing and flossing. But you need a pool cleaner, the dental professional, to get to the grit and rocks, that's the calculus, out from the deep end. At that point, you just need to maintain it. Think of antibiotic therapy as the chlorine. Very good analogy. And finally, let's finish up with Dr. Jeff Bowman on why flossing is just as important as brushing. How you doing with brushing and flossing, we ask. How's your flossing going? They will sometimes say, oh, I brush after every meal now. And I tell them, that's great, but that's not where your disease is. I tell them the old kids' camp skit where a guy is standing under a street lamp looking around for something on the ground. Successive people walk by and ask him what he's doing. I'm looking for my quarter I dropped. So each successive passerby stops to help. And there are 4 or 5 people looking for the corner under the street lamp. Then someone asks, where did you lose it? He says, over there. And he points about 15 feet away in the dark. Well, then why are you looking here? And he says, it's easier to see under the streetlight. I tell them brushing is okay, and it's easier to do that, but it's not going to cure your disease because it's almost entirely between your teeth. Nice. Ladies and gentlemen, I hope you enjoyed these analogies as much as I did, and kudos to these dentists and hygienists for coming up with creative analogies to not only explain what you're doing to the patient, but why. If you can understand the benefit to you and your health, then chances are you will be much more compliant in getting your mouth as healthy as it can be. Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.